Hi, welcome to my channel. So today I'm going to do a video on 100 questions that I've been asked over the past over 17 years about PRP, platelet-rich plasma, and how it benefits, what are the pros and cons, the drawbacks inherent in the technique of PRP for hair loss, both for men and women. Heavily hyped by media and doctors alike, PRP as a treatment defies all scientific sanction and audit. Despite all this, it has become the most popular treatment today for hair loss both in men and women. PRP today has a sanction and a mandate which is not entirely backed by science. It is a living example of how the media and good advertisement can successfully outrun science. But as the dust settles, we still await proper scientific research to catch up with all the hype. So this present video is an attempt in that direction to separate the grain from the chaff, just an attempt to clarify a lot of points, 100 points about PRP, which I'm attempting now. When not much reliable research has gone into PRP, until science catches up, hair loss patients are bound to have more questions than are listed in this video. More questions that can be answered by the doctors, and doctors will continue to answer these questions not backed by science, but by their clinical experience, their conviction, or at times through business expediency. Before we deal with the 100 questions, let me give you a little basic background about PRP. So, hold your horses. People who are balding, especially the youngsters, are very vulnerable. Since hair loss is commonly perceived as a loss of attractiveness by the opposite sex, loss of self-esteem that affects body image, and also perceived that you look older than your chronological age. And this affects people socially as well as professionally. We all know that. And the hair loss industry knows it too. And therefore a lot of treatments, most of them ineffective, are aimed at this category of patients. The patients in their early 20s suffering from hair loss, who are desperate to seek out a treatment, a cure. Many doctors like me may advise against such irrational treatments, but anything that gives hope sells like hotcakes. More so in this field while treating hair loss for both men and women. And one such treatment is PRP, and that is what we are going to discuss today. Many of the answers to these 100 questions will not be very convincing, not backed by science. What I answer is only through my experience of 17-20 years. So if you have any reservations, either accept them or put a comment in the comment section below and I'll try my best to answer. A lot that a doctor knows in this field is through his experience, his conviction, and what his patients tell him. As long as you do not inject PRP with a business model in mind, you are on the right track. So the first question, what is PRP? PRP is the current star performer in the field of regenerative medicine. PRP is a safe, minimally invasive, therapeutic procedure for hair loss, which is increasingly gaining traction amongst doctors, clinics, and patients. PRP involves extracting blood from the patient, processing this blood to concentrate the platelets, and then re-injecting it into the scalp with thin hair or thinning hair so as to stimulate hair growth. This approach capitalizes on the regenerative properties of platelet-rich plasma, properties that potentially enhance hair follicle function and promote hair growth. The growth factors released once PRP is activated are said to promote stem cell activity around the bulge area of the hair follicle, and this in turn prolongs the growing phase of the hair cycle. They also prevent cell death in the dermal papilla. Thirdly, some growth factors that are so activated cause angiogenesis, or the growth of new vessels in the skin. And since more blood supply is brought to the thinning follicles, it does a lot of good to these follicles, which again may spring back to life. The result is increase in hair shaft diameter and increase in density due to a longer anagen phase of the hair cycle. And this can be as much as 15 to 50% and varies from individual to individual. There is no magic wand while treating hair loss, and PRP is surely not one by any stretch of imagination. All hair loss doctors, even those who are skeptics in the use of PRP, would admit that some of their patients, for reasons not known, respond very well to the injection of PRP, even when PRP is given as a standalone treatment. PRP today has a huge following amongst the hair loss community, and patients seek out this treatment from clinics for their hair loss. Many seek it out as an adjunctive treatment to other forms of treatment, in spite of the fact that there is a complete lack of double-blind studies showing the efficacy of PRP for hair loss. Even non-believers inject PRP into their patients, and this is also the case with me. But PRP has its limitations. It has its pros and cons, which we are discussing in this present video. The most important of this is that PRP can only be used in the early stages of hair thinning. Anyone who's slick bald will never, by any stretch of imagination, respond to PRP. PRP is made from autologous blood, so it is very safe, provided the process it is subjected to follows international guidelines. But then there have been reports about cross-contamination, and the worst shining example is 3 patients from the same clinic who reported HIV positive after PRP injection, and this is the case report. Whenever there is a study, not only PRP, in any field in medicine, you have to do your own research and critically analyze if the doctor or the researcher or the scientist doing the research has any conflict of interest. Is there any disclaimer at the end of the research paper? Because especially in the field of hair loss, there are a lot of studies which aim to glamorize ineffective treatment methods to sell a product, and sincere, honest research is hard to find. So check for the conflict of interest by checking out the precedents and antecedents of the person doing the research. In my clinic, we have our own pathology lab, the Amulya Pathology Lab, on the ground floor, and we have the licenses to deal with blood products. However, whether any clinic, any random clinic, can do PRP, handle blood products without permissions, without the guidelines of the National Council, is a question I'm not very sure of. Because to my mind, only licensed laboratories can manufacture PRP, because it is a blood product and it can cause cross-contamination. Especially in clinics which are doing several cases in a day, you can have mixed samples. Mixed samples if proper guidelines, proper protocols are not laid down and not followed. At Darling Buds, I too offer PRP but do not actively promote it. Every patient who walks in is not encouraged to get a PRP done, whether with hair transplant or without hair transplant. However, there are times when a patient cannot have recourse to other forms of treatments because of certain problems. In those cases, I recommend PRP. I evaluate them in great detail and allow them to make an informed decision. I do tell them that it is not a substantiated treatment. Responsiveness to PRP greatly varies from patient to patient. Since it has a wide spectrum of effectivity, it does not work for everyone. Mostly this happens because patients expect too much from a PRP. And why some patients do not respond and others do is still unknown. At Darling Buds Clinic, I use the ASL PRP system. It is a modification of the double centrifuge technique that allows active biological factors of serum to be administered in effective concentrations. The ASL matrix keeps the PRP around the stem cells for a bit longer, allowing platelets to have a more prolonged effect on the hair follicles. Not really. The cure for our baldness does not lie in our blood. Baldness is genetic. It has nothing to do with our blood. The key to baldness lies in our genes, not in our blood cells. The causative factor of baldness is that due to genetics, our follicles become increasingly susceptible to the effect of DHT in the bloodstream. Even small amounts of DHT can cause baldness. This effect of DHT on the follicles is determined by the male pattern baldness gene. So the only cure presently available or which has scientific backing is the decrease of the conversion of testosterone into its active metabolite, DHT. And this is done mostly by using oral DHT blockers. PRP has no role in preventing the progression of baldness. PRP is administered in a clinical setting using 30 to 32 gauge needles. Several injections are given after numbing the area. The depth of the injection is around the bulge, the root of the hair follicles where the stem cells are present. Those suffering from male pattern baldness, those suffering from telogen effluvium, those with thin eyebrows, thin beards, thin mustaches, thin hairlines, and temples report temporary, though at times very fleeting, benefits from the administration of PRP. Wherever there is hair, PRP will cause some benefit. The time taken by PRP is around 1 hour if we do not apply numbing cream, and 2 hours if numbing cream is applied, because it takes about 45 minutes to 1 hour for the numbing cream to take effect. The injection, however, does not even take 1/10 of the time that it takes to prepare PRP. Even the administration of anesthesia, ring block, or nerve block takes longer than the actual administration of platelet-rich plasma. Yes, technically speaking, PRP is invasive because it is administered through an injection. However, this should be labeled as minimally invasive because no cut is involved in the process. Invasive procedures are hair transplants. Non-invasive procedures are treatments like low-level laser therapy and medical treatment for hair loss for men and women. Not much discomfort is involved in the administration of PRP. After the PRP is over, you will be made to rest in the clinic. You can have a cup of coffee with cookies, wait for half an hour, and then you can leave. You can even drive back. However, it is advisable to take it light for the next 2 hours. So if you're working outdoors, if your work involves strenuous activity like farming, you should take the evening off. Many patients would say that yes, PRP has worked for them when used alone. But as a hair loss doctor, having seen umpteen cases over several years, I would take this with a pinch of salt. Many patients benefit psychologically because they think they have spent a lot of money and they do see results which are ambiguous in nature, very subjective. In my mind, it works best when combined with other treatments like DHT blockers, like other stimulants, and miscellaneous lifestyle changes. Now that is $1 million question. If you ever get to the answer, please let me know. But if you really want to get to the root of it, take PRP as a standalone treatment. Take it for about 4 to 6 months without any other form of treatment for your hair loss, and you'll come to know yourself whether this has worked or it was your hair loss medication that was working. Any hair loss treatment that works will cause initial shedding, and this will last from 4 weeks to 6 weeks. Unless, of course, it has catalyzed the progression of your baldness. This shedding may be usually temporary. It is your old hair which are being thrown out, kicked out from your scalp and being replaced by healthy, robust hair which will take one hair cycle to show itself. Since PRP is minimally invasive, yes, diabetics can get PRP done. However, diabetics have a healing disorder as well. And since the very basis of the work of PRP in your scalp is to initiate a healing response, diabetics may not favorably respond to PRP when taken for hair loss. Hair loss has no cure because the cure lies in your genetics, and genes cannot be cured, not yet. With the best medications available at our disposal, we can at best delay the progression of baldness, not stop it completely. We can only slow down hair loss, not cure you of baldness. PRP is an autologous compound which is injected under the skin. Autologous means its origin is from your own body. It is not foreign material. So the body will not reject it, whatever the skin condition. However, in cases where you have certain serious skin conditions or infections, it can flare up an infection. So before going in for a PRP, please consult your doctor. Tell him about your problem, about your skin problem. Let him decide whether PRP is for you, whether he would like to first treat your skin disorder or he can go ahead and treat the skin disorder later. There is no comparison. PRP is not an alternative to a hair transplant. Hair transplant is done when all the hair follicles have fallen off or when the density of hair is so low that there will be no damage to surrounding hair, no shock loss. This is a time when hair transplant is done. PRP in no way is going to avoid a hair transplant because the use of hair transplant is different from PRP. PRP works on existing hair follicles. Hair transplant works when follicles have all fallen off. But how does this question come up? It came up because PRP is being promoted heavily by unethical clinics as an alternative to hair transplant. Give it a thought, use your common sense, and you'll arrive at the answer. 14 days, a fortnight before your hair transplant, please stop using PRP because PRP initiates an inflammatory response. During hair transplant, this inflammation may lead to increased bleeding and a less than optimal procedure. PRP is given before, during, and after the hair transplant in many clinics all around the world. However, protocols for this administration vary immensely. I am not an advocate for PRP used before, during, or after hair transplant. I am only for PRP used as a holding solution during hair transplant surgery because I believe that PRP improves the health of the grafts when they are out of the body, and PRP causes less scarring in the donor area. In my technique, the in vivo preservation technique, I routinely use PRP during the hair transplant process as a holding solution, and I've been doing it for the last several years. However, when my patients ask for PRP to be injected during and after the hair transplant, I do willingly oblige because it is not to treat the hair loss, but to treat their psychology, the bias that they have that PRP will make their hair grow. 2 weeks after the hair transplant, once the crusts have come off, one is ready for a PRP if one wants. Yes, the treatment is meant both for men and women. More commonly used for women because women have thinning hair, whereas men have baldness. PRP is not a treatment for baldness. Yes, on the day of consultation itself, since PRP is a short procedure, you can undergo PRP on the same day itself. You do not have to book an appointment. PRP doesn't take more than 1 hour. So yes, on the day of the consultation, if you want a PRP done and your doctor thinks that you're a candidate, you can go ahead with the PRP on the same day of the consultation. Most patients will not experience any problem after the PRP procedure. However, infrequently, patients have reported little soreness which passes off by the evening. Others experience some heaviness, mild swelling. The numbness persists for about 12 hours. The number of injections depends upon the area that is to be injected. Usually at my clinic, I inject PRP in every 1 square centimeter of the area which is to be treated. During the process of PRP, before PRP is injected, the treatment area is injected with anesthetic. Anesthesia administration usually does not cause any discomfort because various techniques like pressure, vibration, cold are used to mitigate the pain of anesthesia. Anesthesia is essential because injecting PRP under pressure is a very painful process. Some doctors use numbing creams, but for numbing creams you have to wait for about 45 minutes to 1 hour for them to take effect. Other clinics use numbing creams with nerve blocks or ring blocks, and some clinics use all procedures. Though some clinics are known to inject without anesthesia, my patients definitely do not prefer that. This is a huge myth. No, getting pain during PRP has got nothing to do with effectivity of PRP. The administration of anesthesia makes the process more tolerable, more acceptable, and the patient will come back again. The cost of PRP varies across the globe from $50 to as high as $1,000 per session. At my clinic, I charge $300 for A-cell PRP and $180 for 6X PRP. Insurance does not cover any cosmetic procedure, and PRP is one such treatment. So do not expect that you are going to be compensated by the insurance company. You will have to pay for a PRP like a hair transplant from your own pocket. It is cash payment. Yeah, that is a $1 million question. Drop me a note privately and I'll reply back to you. If you've been getting PRP to get rid of your baldness, you have another thought coming. PRP and hair transplant are two different things. PRP is never a replacement for a hair transplant. The indications for hair transplant are when there are no follicles, whereas the indication for PRP is when there are follicles and they are thinning. Both of them have different uses. You cannot choose one over the other. Whenever you start any hair transplant treatment, it takes one full hair cycle to show its effect, and one hair cycle takes 4 to 6 months. So do not expect any result from any treatment, be it medication, be it hair transplant, till 6 months are over. Even after 6 months, if you're a female, the hair will not be as long enough as you may want. So in such cases, you may have to wait for a year to see a good result, the result that you got the procedure done for. If you experience good results after the initiation period of 3 months, PRP results hereafter will last 6 to 12 months, and the duration of effectivity is proportionate to the length of your hair cycle. If you think that PRP is going to reverse your baldness, please save your money and look elsewhere. PRP is not going to regrow your hair in your balding head. It is not going to bring the dead back to life. The commonest indication for PRP is thinning scalp hair. PRP has been used by clinics anywhere in the body to stimulate hair growth. Yes, microneedling is increasingly being used after PRP. Microneedling is another way to stimulate growth. It causes inflammation. Inflammation brings growth factors to the area, more growth factors than PRP does, and this boosts growth even more. So both of them work hand in hand. They complement each other's benefits. 1 millimeter length of the microneedle is the most ideal length. Most optimal results are obtained by 1 millimeter because it also does not cause much pain, much discomfort when you use it at home. However, in clinics, greater depths can be used under the supervision of the doctor. Always remember that using microneedling at home as a home remedy for your hair loss without understanding the basics of asepsis, keeping infection away, can lead to huge disasters. So be careful as far as possible. Get your microneedling done in the clinic itself. PRP is a lunch hour procedure. You can return to work shortly after PRP if your work entails a desk job of sedentary nature. The growth factors that are released by the administration of PRP when PRP gets activated vary from person to person. And the response of hair follicles to these growth factors also vary from one individual to the other. So you can expect variable treatments from person to person. If it didn't work for you, try some other treatment. Non-steroidal anti-inflammatory drugs like aspirin have anti-inflammatory properties. And inflammation is what we kick in by using PRP. Since these two work against each other, it is recommended that aspirin should be stopped at least 7 days before a PRP administration. This would vary immensely. Once the results kick in after the initiation dose, the 3 doses in 3 months, you will require maintenance booster doses, which may vary according to your hair cycle from 4 months to 12 months. Usually there are no side effects of PRP. PRP doesn't have side effects if patients are selected properly by the doctor. Heavy smokers, platelet dysfunction disorders like thrombocytopenia, hyperfibrinogenemia, sepsis, acute infections, chronic liver disease, cancer, pregnancy when mothers are lactating or breastfeeding, and in those who are on blood thinners, PRP should not be done. These instances are a big no-no for PRP administration. I presume that you asked this question because you have androgenic alopecia. Well, Finasteride is a DHT blocker, PRP is not. They have very different mechanisms of action. Finasteride is an established drug for over 30 to 40 years, and it has been successfully used as a DHT blocker in the treatment of baldness, male pattern baldness. PRP, not being a DHT blocker, will not stop the progression of baldness. At best, it can cause some relief, which can be momentary, fleeting in nature, requiring repeated injections. Finasteride as well has to be used for a prolonged period of time till your baldness stabilizes. However, if you are not a candidate for Finasteride, everybody is not, PRP is the next best thing along with minoxidil and microneedling. Yes, PRP is usually, more often than not, combined with other treatments like DHT blockers, like stimulants, of which minoxidil, oral or topical, microneedling, low-level laser therapy, and a host of other treatments. Never, as long as you have thinning, it is never too late to start a treatment for your hair loss. If you have complete baldness, however, or near baldness, please remove PRP from your wish list. An extracellular matrix is a type of a bioscaffolding that significantly impacts hair growth. At my clinic, we use A-cell, while other clinics may be using Bio-D or other ECMs along with PRP, with the aim to significantly strengthen hair follicles by activating dormant stem cells. This leads to more robust, healthier growth of the hair follicles. It most certainly is not permanent. You need repeated injections of PRP to continue to maintain your result. Before PRP, do not scratch your head. Make sure you do not have scalp infection. Keep your scalp hygiene proper. Do not take non-steroidal anti-inflammatory drugs like aspirin, like ibuprofen. Do not take vitamin C. Drink a lot of water before the procedure. After the PRP procedure is over, you are recommended to rest for about 2 hours to take it easy. Do not take a hair wash till the next morning. Stay off non-steroidal anti-inflammatory drugs. Do not smoke, do not consume alcohol for 72 hours. Do not have a head wash till the next day morning. Do not engage in heavy exercise the same evening. Put off your exercise routine for the day. There is no downtime as such after PRP, but if you want to put it down in figures, it is 2 hours after the procedure. Whereas people use the same acronym PRP for the preparations that are given in this name, there exists tremendous variation in the product, in the final product that you get. And this depends upon variable ways that clinics use to process PRP. Your sample, if poorly processed, may not only contain PRP, but besides that, it may contain other ingredients, other constituents of blood, which are not welcome in this solution, like WBCs, RBCs in abundance, if fractionation has not been proper. Ever since I started doing PRPs in 2011, I have graduated to my final machine, which I have now, and I've used 4 machines in the past 12 years. The technology in this field of centrifugation, PRP systems, has tremendously evolved over the last 10 years. And since I have my own lab in the same premises as Darling Buds Clinic in Five Rivers Hospital, each sample that we take, we have been analyzing it under the microscope to see how much platelet concentration we get in each sample. And I then discovered that what I used in 2011 was hardly a platelet concentrate, because it contained a fair amount of impurities. Because those were the basic centrifuges we used those days. There are clinics which are still using those. These centrifuges cost just about $80 or $90. And you can imagine the amount of technology that they have to separate PRP. And you can order them online. through Amazon. And all this because patients have no idea what they're getting. Patients just want PRP. And doctors respond to that because patients are not well educated about PRP systems. Doctors also are not too convinced about the benefits of PRP. And since there is no benefit in the monetary sense, they shy away from investing in costly equipment. There are so many permutations and combinations about PRP systems, that unless we start talking about the same thing, we are not going to be able to compare results in different clinics. My current system that I use concentrates platelets to anywhere between 6x to 12x concentration. In my clinic, every PRP is microscopically assessed as regards how much of the fraction that I have obtained is PRP and what is the concentration of these platelets. PRP is most effective when the cause of hair loss is multifactorial, like female pattern hair loss. In male pattern hair loss, because the cause is genetic than anything else, its effectivity is less than while treating hair loss in women. Platelet-rich plasma is by definition a volume of your autologous plasma that has a platelet concentration well above baseline. While the normal platelet count in whole blood is 200,000 per mil, the platelet count in PRP should on average be 100,000 per mil. There is no agreement that increasing concentrations above 6x are going to give any additional benefit. On the other hand, super concentrated PRP 12x may be detrimental for hair growth or for any other rejuvenative purpose, since it contains high levels of EGF and FGF5, both of which have been shown to be inhibitory for hair growth. The most ideal RPM for a centrifuge machine for making PRP is 1800 revolutions per minute over a sustained period of 10 minutes. Nowadays people talk of G. 100 to 300 G, that means 100 to 300 times the gravitational pull for 5 to 10 minutes for the first spin, and 400 to 700 G for 10 to 17 minutes for the second spin. I inject PRP myself under local anesthesia in proper dosage concentration after activating the PRP with calcium chloride. There are certain skill sets and certain learning before you embark on your PRP journey in your practice, the rigors of which have to be endured if you have to be a good PRP injector. PRP is injected adjacent to the bulge area of the follicle where the maximum concentration of stem cells exists. And this is no deeper than 3 to 4 millimeters from the skin surface. If you inject deeper, it's not going to help. In fact, the PRP is not going to lie adjacent to this area which we seek to stimulate. Well, it is considered by many patients who do not respond to be a scam, and hard sell by clinics makes it doubly appear so. It may also appear to be a scam if not given for the right indication, or if a product that is injected is a far cry from being called platelet-rich plasma in the true sense of the term. What most run-of-the-mills are offering is not helping the industry. It is pure hype, bad products, pure bullshit. Mostly they are withdrawing the patient's blood, subjecting it to mild centrifugation and re-injecting the blood into the patient without knowing the concentration of PRP and the impurities inherent in this sample that are going into the bloodstream. The patient is oblivious of the fact that he's going through the process without any benefit, getting so many injections done, wasting his time, and all coming to naught. So this is not going to help anybody. Firstly, PRP doesn't work, and if you're not injecting the right PRP, how can you expect any result at all? What is causing immense headache to PRP research is what is called as heterogeneity of the sample, and what non-specialists, laymen, call as comparing apples with oranges. Whereas in a clinical trial where a drug is being compared, the drug contains the same amount of the compound, standardized compound, in clinical trials. But in the case of PRP, this is rendered so difficult, a Herculean task, because you are comparing PRP which has been obtained by different protocols, by different machines, by different convictions, and therefore these products that we obtain and call PRP will vary in different ways, including the concentration of PRP, the amount of white blood cells, the amount of red blood cells that have sneaked in. But for PRP researchers, any negative study can be explained away by saying that the particular PRP machine used in the trial produced the wrong stuff rather than the right stuff it should have produced. Doctors understand all this, and therefore most of them are not so gung-ho about the benefits of PRP. Patients today believe in PRP more than their doctors. That is a fact. So while going in for PRP for hair loss, consider the doctor's credentials, his reputation in the area. Ask the doctor since when he has been administering PRP and how many PRP injections does he perform. A practitioner who's a medical doctor who specialized in the field of hair loss, treatment for hair loss for men and women, hair transplants, is most likely well educated in the field of PRP for regenerative medicine than others in run-of-the-mill clinics. Number 2 is honesty of the treatment plan. Do you feel uncomfortable? Do you think that the PRP is being sold to you? It feels more like a sales pitch that the clinic is trying to impose this treatment on your scalp. Did the clinic discuss other treatments besides PRP for hair loss treatment? Or they are adamant that only PRP will give you a result? In general, we should stay away from PRP-only practitioners. Thirdly, ask the doctor about the plan. How many injections you're going to get, over what duration, what frequency, the do's and don'ts before and after the procedure, and what the follow-up is going to be. What are the benefits you're likely to expect from PRP? Will PRP injection meet your goals and objectives, or the doctor is not very sure? The clinic where you get your PRP should have sterility procedures in place. There should be standard operating procedures to prevent cross-contamination, to prevent mixture of samples, because there are so many patients getting PRP done. Does the clinic have a proper protocol for collecting PRP? What are the machines being used? Is blood sample collected in ACD mixture? Is the PRP activated before injection? These are the things that are very important before you plan to take PRP. Because what goes as PRP in the market is a shoddy product on most occasions. It is not the PRP that is going to be effective for your hair loss treatment. You will go through the process without any benefit if these considerations are not kept in mind while doing your research about where you're going to get your PRP done. And that is the reason why PRP cost varies in India from just 1,000 rupees to 30,000 rupees per session. So this depends upon whom you ask. The science of PRP or the testimonials about PRP on various websites all over the net. The testimonials, of course, are giving a resounding yes, but science is more restrained. It is less enthusiastic about PRP. So I hope you get the answer. There are so many variables, as I discussed before, how the sample for PRP is collected, how the procedure of centrifugation varies from clinic to clinic, and individual variation in response to growth factors. So there is no exact answer why PRP doesn't work for some people and it works for the others. It could also be that the injections were too traumatic and this is shedding due to trauma, or the injections have triggered the progression of baldness, or the shedding was just coincidental and it's a progression that has kick-started. The needle that I usually use is 32 gauge needle of 4 millimeter length. If you're using a dermaroller at home, I think 0.5 millimeter should be sufficient, because if you use greater lengths, it is going to be more painful, and if you do not know how to apply it, it can cause scarring. It can further aggravate shedding. Besides, it is a great risk because deeper penetration can cause infection if this is not done with sterile precautions. And most people are not educated, and it is not a non-invasive procedure. This can cause severe infection and you can have hell to pay for what might result. You can do routine exercises after 12 hours. There is no problem about exercise. But if you can postpone strenuous activity till the next day, that is more welcome. Laser treatment is a non-invasive procedure, whereas PRP is a minimally invasive procedure because we stick a needle into the skin. Just like PRP, laser treatment is not supported by robust scientific research. However, PRP is much more popular amongst the patients and amongst the doctors, the healthcare providers, for treating hair loss. Yes, vampire facials or PRP facelifts can be done along with PRP for the scalp. In our clinic, yes, all viral markers, HIV, HCV, HPV, are done prior to injection of PRP so that we are alert, better care is given, and also to save ourselves from medico-legal entanglement. A patient who has HIV can go in for a PRP provided his viral load is minimal. Dandruff is a benign skin condition which exists in the upper layer of the skin, and we are giving PRP injection deeper, 4 millimeters deep, below the skin surface. So it has no role to play. A person who has flaky dandruff can go in for PRP injection without any problem. It is not an impediment to PRP. The brain is very deep, and then it is also protected by a thick layer of calvarial bone, the skull bone. And we are using a needle which is just 4 millimeters deep, which is barely transgressing 1/3 of the thickness of the skin. So it is a very safe process. There is no way that we can even go near the brain. The skull bone is so tough that even with a burr machine, which is very powerful, you get a hard time getting to the brain. So a 32 gauge needle is very innocuous. It can do no harm. PRP generally is not given before the age of 18 years. Preferably, you should not drive back home after the PRP injection. But if you waited in the clinic for long enough and you feel comfortable, if the doctor permits you, you surely can. Do not go near heavy machinery. Stay away from heavy strenuous activity. Yes, you can do that the next morning. Do not use a blow dryer on hot setting because your scalp might still be numb and you might cause superficial burns. For the first 72 hours, if you have to use blow dryer, use it at room temperature setting. Yeah, I can understand your concerns as a Seventh-day Adventist, but this being your own blood, I do not think there's any reservation in your religion that you cannot take your own blood product. But you can discuss it with your priest and let us know. There are other, sometimes even better ways to treat your hair loss, so you can consider those as well if you have reservations. By no way can PRP reverse the graying of hair. The graying of hair in most cases is genetically determined. It is like the printer running out of ink. PRP is not going to create melanin. It's not going to reload ink into your hair follicles. So do not get misguided. Believe in science, do your research before opting for PRP for reducing your graying hair. Yes, if you have exams and you have about 12 to 24 hours to spare, yes, please go ahead with your PRP session. It is not going to interfere in any way in your preparation or during your examination. Hairline recession, as contrasted with male pattern baldness causing hairline recession, just plain simple hairline recession is a strong familial trait. And this is so strong that it cannot be controlled either by Finasteride, leave alone through PRP. Whether you take Finasteride, whether you take PRP, your hairline trait will set back to where it has been determined in your genetics. And this is not male pattern baldness. This is just a trait, it runs through your family. The hair along the hairline are genetically programmed to die out and recede till you achieve the hairline of your family. However, if hairline recession is due to male pattern baldness or female pattern hair loss, you can expect some benefit through PRP. GFC is concentrated delivery of platelets. And I have covered this in a previous question about the concentrations of PRP that should not be exceeded. Super concentration of PRP is not good because it releases certain diverse growth factors that are detrimental to hair growth. However, GFC is very popular. Do your research, ask your doctor about GFC, ask the doctor about 6x PRP, and then go ahead with your treatment. If you have fever before PRP, get well, keep a gap of about 72 hours before you get well, before thinking about PRP. A swelling after PRP is very, very rare if proper technique is used, if the right size of the needle is used, if patients with bleeding disorders are weeded out, if patients have been prepared properly, non-steroidal anti-inflammatory drugs have been stopped, and they have been cautioned against using certain supplements that can cause bleeding, swelling of the face is rarely seen. Stem cells are completely different from PRP. Stem cells are what PRP aims to stimulate. Stem cells exist around the bulge area of the hair follicle, and we aim at giving PRP around that area so that the growth factors will stimulate the regenerative process around the bulge area of the hair follicle. In my clinic, I give about 0.1 milliliter of PRP in each 1 centimeter square area of the scalp. However, there is no agreement on how much volume is to be injected. As far as concentration goes, about 6x concentration of PRP is accepted as the most optimal concentration. Above this concentration, as discussed before, you will get more harm than good. As this chart denotes, there is an initiation phase of PRP, 3 injections, 3 weeks apart, followed by maintenance doses, which can vary between 6 months to 8 months intervals, and after about a year, it can be on as required basis. It is the initiation phase which decides for me in my clinic, in my protocol, whether to go ahead with further injections or not. If the patient has not responded, we stop injections and give other treatments for patients' hair loss. Through photographic comparison and trichological assessment from time to time as the patient visits again for PRP, and if the hair shaft diameter shows a steady increase in size and the density of hair per centimeter square due to prolongation of the anagen phase is positive, then I go on to the maintenance phase of PRP. PRP then, in this case, will be given every 4 months, 6 months, 8 months, or 9 months, or on as required basis, as may be assessed, keeping the patient's goals and objectives in mind and the patient's availability in mind, and also the budgetary constraints, which of course are very important. PRP utilizes the body's own natural resources to heal itself, to regenerate itself. There is no additive, no chemical that is added. So it is completely safe treatment. There are no side effects because it's your own blood which is already coursing through your veins and your arteries. The only thing, it is slightly modified and re-injected to cause its salubrious benefits. Only medical doctors are authorized to inject PRP. However, it is a rampant practice all over the world. Anybody today is injecting PRP into any location. There seems to be no restraint in who can inject PRP and who cannot. And do not expect in the near future that this field will be regulated. On the morning of the procedure, please take a light breakfast. PRP is done under local anesthesia. There is no sedation involved, no general anesthesia involved. And we do not want you to be empty stomach and feel queasy, because it's natural to be anxious on the day of your first PRP. So please have your normal breakfast, have a cup of tea, have a cup of coffee in the morning. And if you do not have any time, you can ask for it in the clinic. Our pantry will serve you. It is becoming a routine whenever any treatment is offered for hair loss treatment in men and women. The first question that comes to the patient's mind is, will this cause any sexual problems? Will this decrease my libido? Will it likely cause erectile dysfunction? Well, there is so much confusion on the internet that it is not the patient's fault. Even the strongest of medication used in hair loss treatment for men and women does not cause this. If the patient has been evaluated properly, if his blood work has been done, there is no way a patient will get sexual disorders. Leave alone by PRP, because PRP is your own blood. It is only being modified and re-injected without addition of any drugs, any chemicals that can cause harm. After the procedure is over, we will give you a head wash. Do not shampoo your head at your home or in a salon for 72 hours after the procedure. If you're getting a PRP for the scalp and also a vampire facial or a PRP facelift the same day, I would advise that first you get Botox treatment done, wait for half an hour, and then get PRP treatment for scalp and the face done. Because when PRP is given for the face, there is slight plumping and the anatomical landmarks may be lost, making it difficult for Botox injection. After PRP injection, please do not go out in the sun for 72 hours without wearing a hat. Smoking is a big problem when we are aiming to regenerate the body's cells, enhancing the healing process of the body. If you are a heavy smoker, if you smoke more than 4 cigarettes in a day, it is advised that you cut it down to 1 or 2 in a day when you are undergoing PRP treatments. Because otherwise, PRP treatments, like many other treatments for the body, do not go hand in hand when you smoke tobacco. There is no point injecting PRP without activating it before the injection. In my practice, I use 10% calcium chloride, 100 milligram per mil, and I add it into the PRP solution, 3 milligrams per ml of PRP. Others may like to use the freeze-thaw cycle to activate PRP before injection. And there are many others who take solace from the fact and strongly believe that the mere act of PRP flowing out through a small 32 gauge needle will activate PRP. Hematologists created PRP in the early 70s to treat platelet disorders like thrombocytopenia, that is decrease of platelets in the blood. But since 2010, PRP has been used by many specialties, chiefly in pain medicine, in sports medicine, and of late in regenerative medicine, of which hair loss is one. Almost every specialty and subspecialty have discovered for themselves various indications for the use of PRP one way or the other. Yes, if you are traveling mostly, you cannot adhere to a routine in one clinic. You are most welcome. Go to another clinic for the second, third, whatever injections you may want to take from there. But carry your old records. Select a clinic with due research, a reputed clinic in the locality where you are visiting. PRP can fail because of low concentration of PRP. PRP can fail if PRP is not activated properly. PRP can also fail if excessively high concentrations, super concentration PRPs are used. PRPs can also fail when the hair loss is very aggressive. Also due to improper delivery of PRP, PRP not delivered in the right depth, PRP not used in the right indications, use of PRP in a patient who is a heavy smoker. However, the biggest reason for failure of PRP is staring you at your face. Cryopreservation, much talked about these days, is a safe procedure which sufficiently preserves PRP quality and its ability to cause regeneration. While scientific evidence regarding the efficacy of PRP remains inconclusive, we at Darling Buds Clinic remain ever vigilant in monitoring research developments in this field, patient response to PRP, and maintain a record to assess patient response over the years. Ultimately, you must realize that there is no one size that fits all in hair loss treatment for men and women. PRP should be approached as only one potential tool in our armamentarium of a comprehensive approach for hair loss treatment for men and women. So that was the talk about PRP. So do your research before going in for your PRP session. Think about the pros and cons, whether PRP is meant for you or you would like to go for some other treatment. If you have any questions about hair loss treatment for men and women in general, and about PRP in this video in particular, please let me know. Put a question in the comment section below and I'll get back to you. If you want a personalized consultation on the other hand, please contact us on WhatsApp on the number given above and we won't disappoint you. For those who haven't subscribed yet, please do. Your engagement, your encouragement keeps the channel going. Have a nice day and may God bless you.